Drew here at ASAPS 2018. This time I'm joined by Dr. Holley. Thanks for joining me.
Good to see you, Drew.
Kalamazoo?
Yes.
How's the show going so far?
Oh, it's great.
Cool.
This is the Aesthetic Meeting 2018 in New York. It's a fantastic meeting. It is every year, where all of the aesthetic surgeons that focus on the aesthetic side of plastic surgery gather, share educational experiences, look into new technology. There's a lot to do.
Yeah, awesome. Talk to me about some of the new technologies that you've seen here.
Yeah, it's exciting. I spent about half my time, I think, at these meetings talking to colleagues about new technology that's coming along, visiting the many vendors here. This is, what, 1, 2, 3 football field?
It's massive.
Size room.
And it keeps getting bigger.
Filled with lasers and liposuction machines and skincare products and, anything that you...
Robotic arms for hair transplant.
Yes.
Yeah.
Marketing companies everywhere. Yeah. So there's a lot to do, and it's always great. Great opportunity.
Cool.
I try to come to the Aesthetic Society meeting at least every other year or so just to keep up with things.
Awesome. How long have you been coming to this show for?
Yeah, I've been an ASAPS member since 2003. So,
oh, wow.
15 years now. I have a mixed practice where I still do reconstructive surgery.
Okay.
But every year I'm doing more and more aesthetic surgery. There's, I think, as many people know, a growing demand for aesthetics.
Yeah.
Both on the surgical side and the non-surgical side of cosmetic medicine.
Sure.
So it takes some work to keep up to date and stay on the cutting edge.
You guys have the hardest job in the world. I always say that. Not only do you have to stay cutting edge with being a plastic surgeon, but you also have to run a business.
That's very true.
It's very difficult.
Very true. There are not many surgeons here that aren't independent business owners.
Right.
That interesting you bring that up. That's become a rarity in medicine at large.
Yeah.
So we're an interesting group where we have to look at the bottom line and find a way to practice that delivers great results, but we've got to run a business
lots
as well.
Of big decisions
and
a
lot of this equipment is really expensive, so
yes.
Part of the evaluation is really understanding where the trends are going, what your local market is like, what the demand is for a particular product. It may be different for me in Kalamazoo, Michigan than someone in Beverly Hills.
Sure.
We have a lot of commonality, but you have to apply these things to your local market.
Yeah, absolutely. That's good advice right there. Talk to me about, 2003, you've been a member. Talk to me about what it was like in 2003 versus what it's like now, how it's changed.
Yeah, that's an interesting question. I think, like in any industry, there are waves of enthusiasm for certain technology that works and sticks, and then there's an evolution of change to different things. Lasers, for instance.
Yeah.
At that time, CO2 lasers were very popular. They were very powerful. They were almost too powerful. Now, laser technology and skincare technology has changed because clients are coming in asking for no downtime or little downtime. Those older technologies that were more powerful, you had to plan for a couple of weeks of downtime. Now, with the innovations of technology that we have, I have a Cyton laser platform in my office, which I love. We have many, many applications of treatments that are little to no downtime. And so I think people are looking for smaller results, smaller incremental results with
more
less downtime.
subtle.
And that's the movement right now is, is while surgery numbers by our statistics in the society that we gather each year are still going up, the thing that's going through the roof is the non-surgical area. Those things like Botox, fillers, hyaluronic fillers, laser treatments, skincare.
Yeah, cool, awesome. So where do you think you see this going in the next 10 years?
Yeah, another great question. I think, we look at the demographics of aging baby boomers,
Yeah.
we're kind of in that sweet spot right now. There's a lot of talk now about millennials and gearing our practice towards millennials. A lot of effort is going into understanding them, that group as
Yeah.
consumers. How do we reach out to them? How do we market them to them? What products or services are they most interested in? And you see a lot of the education being discussed towards those consumers. You see the products being developed for those consumers. So I think we'll continue to see that. I think there will continue to be great growth on the non-surgical side of the practice. I think surgery will always be there with a steady rise.
Yeah.
Everybody wants to look good.
Right.
But what is nice, and it's fun, as a provider, is to have a larger toolbox of things that I can offer people that is non-surgical. It's a little less scary, there's a little less downtime, and that's what people are asking for right now.
Right. Something for everybody,
Yeah,
right?
yeah.
Cool. Well, let's recap, or let's just finish here. Tell me a little bit more about your practice. I know you touched on it a little bit about being reconstructive and aesthetic,
Right.
but talk to me a little bit more about what you do.
I've been in West Michigan for, I think it's my 21st year now. I've always done aesthetic surgery. I think like many young practitioners, when I started out, I did more reconstruction, still do hand surgery, but I am focusing over the past 10 years and into the future more and more on aesthetics. I primarily focus on breast and body contouring.
Okay.
Still do a fair amount of facial.
Yeah.
But my sweet spot is breast augmentation, tummy tucks, mommy makeovers.
Okay, cool.
And I find that very rewarding. You know, helping women that have been through a pregnancy.
Yeah.
Those pregnancies do things to the body that you just can't undo in the gym.
Sure.
So I love it when someone comes and for a consultation, trying to gain information on what can be done.
Yeah. Love it. You may have just answered it, but what is it? What is the favorite part of your job?
Yeah, I think it's, I say this all the time. I'm really fortunate. I think anybody that can say, I really love what I do and I'm good at it, count yourself lucky.
100%.
And I feel very fortunate to do what I do. It's a blend of technical skills and a little artistry and communication with people.
Yeah.
And, you know, I found something that I'm lucky to do.
Cool. Awesome. Good stuff. Well,
Yeah.
thanks for joining us.
Yeah.
Appreciate it.